Hi, good evening, everyone, and welcome to the Delaware County Health Department Board of Health meeting. I'm Rosemary Holt and the chair of the meeting. And I was just, since we're all new, I was just going to have everybody go through and just introduce yourselves one more time since. Anne-Marie, you want to start?
Hi, I'm Anne-Marie Hirsch.
Hi, I'm Lily Higgins.
I'm PJ Brennan.
Hi, I'm Oni Richards.
Okay, thank you. All right, and to begin today, I just want to have the approval of our minutes from the last meeting. And I just need somebody to make it.
Motion for approval?
Second.
All right. Minutes? Okay, none. All right, and all those in favor?
Aye.
Hi.
Okay, the minutes have been approved. Okay, also, I wanted to check in to see if we have any public comment on the agenda items for today. Okay.
I'd like to comment, but I'm not really sure how to, because the agenda hasn't been gone through yet.
Okay, we do have opportunity for public comments at the end. Would you like to do that at that point? Okay, great. Okay. And we're very happy today to have our economic impact study presented, and I believe it's Jim Diffley doing the presentation from IH at Market. Jim, if you wanted to just begin, we'd be happy to hear all about the economic impact study.
Thank you, thank you. Glad to be here and be part of getting this health department going. We appreciate Howard and his team's efforts and contributions as we put this study together. Now, I'm an economist at IHS Market, and I'm joined on the call through Zoom by two healthcare experts, Carrie Jones and Teresa Anselmo. And I guess they're available to answer questions if they're above me, if you will. Here is the agenda. Okay. As I said, I'm the executive charge. Carrie Jones is working as the project manager, and Teresa is a consultant that we brought into this project with a lot of experience in healthcare of this sort, as you'll see. So, we'll look in order at budget impact, revenues, expenses, budget implications, induced and indirect economic effects, estimated value, the value to the county of health benefits generated by the health department, and the overall economic impact. The task was to conduct an economic study of the cost of creating and housing and operating a county health department in Delaware County. Your team described your plans in detail. We analyzed the implications of those plans, and were guided by the experience of other health departments across the U.S. Teresa in particular was very instrumental, as she had great experience in Jefferson County, Colorado, which was a similar health department, in a sense, a similar community in terms of size, economic activity, relation to a large urban center, Philadelphia, in your case, Denver in her case. The economics team assessed the fiscal and budget balance and the economic impacts. So we're looking at the health department budget itself, any other economic impacts that are created by the activity of the health department, and we delivered a written report. We're doing the current presentation. And in addition, we provided, for your use in the future, an Excel-based economic impact tool that makes calculations given your selected differential inputs. So for instance, if you had planned and we had simulated the effect of hiring, say, 5 nurses in a particular function, and you wanted to increase that to 10, the Excel tool allows you to do that directly, and then the Excel sheet plays out the implications of that in terms of the rest of the study, in terms of the budget balance, the revenues needed, et cetera. Okay? This tool, this phase of the projects was presented by you to us, so we understood the first phase, now until 2024, the middle years, and the end game there. These three development phases were identified as a launch phase, starting with the streamlined health department providing basic services as required by the state of Pennsylvania. So we're looked into what the basic requirements are for accreditation, et cetera. There was a build-up phase over time to meet the public health needs not otherwise covered by Act 315, and to establish the capacity needed to meet the national standards for county health departments as delineated by the Public Health Accreditation Board. And then 3, the achievement of the Public Health Accreditation Board accreditation. During each phase, the health department would refine its focus, address priority issues identified in collaboration with partners and the community. Now, the framework was based, as I said, on the budget for Jefferson County, Colorado, which we had experience with, but it is similar to Philadelphia in many ways. We're not arguing it's identical, but it provided a template for us to examine and think about how the department would be structured and what the financing, building, et cetera, needs would be. The budget is not based on programs, many of the details of which are not yet known, and we assume they'll continue to evolve in the coming months and years, but rather on goods and services categories. As such, the Jefferson County budget was used as a framework because it was detailed, and so detailed costs by the goods and service categories that they had experience with. And we thought it was reasonable, and we discussed it with Howard and his team, the appropriateness of that. While the planning team has released the anticipated path for phases 1 and 2, the details of the new structure, services provided, and exact revenues are expected and will to continue to evolve over time. As such, the economic impact tool will be and has been customized with updated parameters as the details unfold. Okay, so what is the budget impact? On the upper right-hand corner, you see the sources of funds broken down: Medicaid fees, Medicare fees, et cetera. On the left-hand side, you see the expected revenues from the American Rescue Plan, most recently Title V funds, CDC pass-throughs, et cetera. While the exact amount of revenues that will derive from each source cannot be precisely known, estimates are based on best information at this time from both the Delaware County team and our consultant, Teresa, who has 20 years of experience working with local health departments such as you're developing. Of course, funding patterns for local health departments can vary widely. Note that Delaware County expects to receive much of its funding from federal and state sources. We've identified them in orange and gray on the bar chart in the graph. Inspection and permit fees are expected to cover costs of inspections and permitting operations and make up approximately 20% of the revenues. We'll note that the magnitudes of the reported state and federal pass-through funds per capita are low for Pennsylvania. A 2017 report noted that Pennsylvania ranked 49th among states in per capita funding, CDC funding, and 31st for per capita HRSA, Health Resources and Services Administration funding. In 2020, Pennsylvania ranked 48th among states in per person state public health funding. The main state funds for public health under Acts 315 and 12 decreased by 40% between 2010 and 2019 when adjusted for inflation. Given that, a substantial amount of annual health department revenues are expected to come from county taxes, new county taxes. And working with the team and Howard, we used a figure of 30% of the expenses would be borne by the new taxes, okay, in terms of to do our simulations. Federal funds are as high as 29% of projected expenses in the early years. And the early years is when more sources and estimated amounts of funding can be predicted with greater likelihood. But they settle to about 15% at full scale. That is, federal funds carry about 15% of the cost at full scale in our simulation. State funds range from 18% to 43% of expected expenses, with 36% the number at full scale in the last part of the build-out. Okay, so the budget impact in expected expenses are detailed on the left columns. The major expense categories, 84% going to salary and benefits for the staff, 4% to supplies and goods, 11% to other services, and then some interdepartmental expenditures. And they're illustrated in the bar charts on the right. For health departments, looking at other health departments now, serving 500,000 to 1 million people, the national average expenditures in 2019 were almost $47 million per annual. With the first quartile, about $17 million, that is the lowest 25%, lowest quarter of states with health departments, or $24 per county resident, so $24 per capita for the county. For Jefferson County, which is, as I said, our model here, expenditures were $18.5 million in 2020, which is near the first quartile in spending for health departments serving similar sized populations. That's more than 40% higher, so notice we're comparing Jefferson now with Chester County, your neighbor. Their budget was $13 million, proportionally much smaller than Jefferson County. And of course, I caution that the 2020 numbers are no doubt influenced by COVID in some way that's not quite predictable. A comparison of the 2019 Pennsylvania County Health Departments, excluding Philadelphia, which is unique, on spending per capita shows that Delaware County's projected per capita health department spending is in line with the other counties. For instance, $18.45 per person in Delaware County versus $17.94 in the other counties, just slightly above. Again, the COVID spending at the time, during the time may have influenced some of those numbers. So in terms of the budget impact, first on salaries and benefits, they're by far the largest costs, 84% of expenditures for the full-scale health department. Chester County's, we look at Chester County's budget, personnel expenses were 71% of the total in 2019. Alleghany's, 86%, and Jefferson County and Colorado were 80%, to give you an idea of the range we had there. What we did for in each case is we identified the type of person who would be employed, be it a nurse, technician, et cetera, to estimate salaries for each job title. The estimated number of full-time equivalent employees would range from 67.5 in phase 1 to 83.5 in phase 2. So we had salaries for each job title. We consulted what Bucks and Montgomery's salaries were, so we could get a sense of the market. In some cases, we used government salaries for Pennsylvania, which we understand that all of Pennsylvania is a little different than the Philadelphia metro. All right? But that's the way we estimated what the salary cost would be. Many expenses are prorated across years based on the percentage of full-time equivalents estimated for Delaware County in the projection year relative to the estimate for full-time equivalents at full scale in the future, okay? Moreover, other entities, well, I think I'll skip that, just to mention that we did take into account work that the Foundation for Delaware County has done, Healthy Start, Nurse Family Partnership, et cetera, in trying to understand how the allocation of healthcare in the county would be changed by the department. According to the National Association of County and City Health Officials, a local health department serving Delaware County's population would employ, in their estimate, 223 full-time equivalents, so quite a bit more. So Delaware is only 37% of the national average for departments serving similar sized populations. Jefferson County employs about 180, more than double those projected for Delaware, even though it's about the same size. Chester County's expected to employ approximately 124.5 in 2022. further analysis showed that in Kentucky, a minimum of 3 full-time equivalents were needed to perform foundational public health services, with an additional full-time equivalent for each 5,000 people served over 15,000, which that analysis translates to about 115 full-time equivalents for Delaware County. So that's the way our numbers shape up with how other health departments are funded at the current, staffed at the current time. So budget implications. County taxes are expected to close the gap, right? We assumed revenues of 30%, as I mentioned earlier. 30% of expected expenses would have to be provided by the county. And they ranges from $800,000 to $2.4 million over the course of the time. And it may be seen as a cushion if realized expenses exceed expected expenses, or as potential, either a cushion for shortfalls or potential to expand program offerings. Under current assumptions, after the first several years, county taxes of about 22% of expected expenses would balance the health department's budget. That is, the county would need to fund about 22% of the costs, our estimated costs of the center, the department. Now, what about the economic impacts? You're adding a new health department in Delaware County. It's hiring people. It's buying goods and services from the community and from distant communities, to the extent things have to be purchased from other states, even countries. But this economic activity has its own economic multiplier effects. That is, the fact that you're hiring people, increasing the number of people employed in Delaware County, generates income. That income is used by those people to buy other goods, personal consumer goods. The spending you do for intermediate supplies and operating, it gives revenues to businesses who spend in the community, not all of their money in the community. We have economic multiplier models that examine how much of that direct spending in a particular geography, in this case Delaware County, translates into increased demand for other goods in Delaware County. Anything that's spent outside of Delaware County doesn't count in a sense. So we have estimates of how much would be spent in county, and then how much that would generate further activity in the county. Those are called the direct contributions, the immediate spending. The indirect contributions are the spending of the sellers of the goods and services to the health department. And then the induced contributions are the extra spending of the individuals, workers, who have higher income because they're employed either directly at the health department or have their employment funded indirectly from the health department's purchases of other services. They are able to spend more, and some of that spending, again, not all of it, will be spent in Delaware County, generating economic impacts in Delaware County. So the results of our study, and we do this for all sorts of facilities and investments in communities. The construction phase itself will generate $3.9 million of indirect and induced sales. While the construction jobs themselves are transitory, that is, they're limited in time, the additional income from 50 county jobs created will generate $3.5 million of labor income every year in the county. Direct spending by the health department supports jobs, wages, and additional tax revenues, of course. In phase one, the $10 million direct spend will return nearly 40% in additional sales throughout the county, additional sales of other different goods and services. That additional sales impact remains close to 40%, that is 40% of the spending, at the full scale of the health department. So we can plot and have plotted how the economic impact grows over time. The additional sales impact remains close to 40%, as I said. Annual state and local tax impacts are between $215,000 and $250,000 for the state and Delaware County. That's additional taxes paid to the county as a result of the increased activity generated by the department. Now, that slide discussion was about the economic impact, direct economic impact on the county. I'm the economist here. Carrie and Teresa are the health experts. So they are familiar with and have worked on studies that estimate the value of the health benefits generated by the activity of the health department. So other studies have provided ROI, return on investment studies, that is how much gain in monetary value from improved health is gained on the investment of additional healthcare resources. In this case, the new spending by the Delaware County Health Department. Lead hazard control as a program for environmental health gets an annual return of $1.48 for each dollar invested. Family programs for personal health, $1.42 per dollar invested. Interagency emergency preparedness programs, $2 per dollar invested. The average weighted ROI of these things is $1.52 per dollar spent. So that's like a multiplier similar to the economic multipliers, but now we're talking about health advantages. Based on proportions, and that $1.52 is based on the proportions for the allocated spending in Chester County, as an example, which would be somewhat similar to Delaware. While linking public health spending, or any social spending, to later societal outcomes is difficult, some studies do link improved population health and lower mortality to investment in public health interventions. So the ROI should be thought of as reduced healthcare cost, increased lifetime earning, decreased special education costs, and reduced cost of crime, to the extent that is ameliorated to some degree. So the expected overall impact, putting these together, under our current assumptions, the county health department will run a budget surplus and will generate annual economic and health benefits valued at over $30 million when fully accredited. And the bar chart on the right divides those into direct, indirect, and induced. Blue for the direct economic impact, orange for the indirect and induced economic impact, that's the economic multipliers, and gray for the valuation of the health impacts, which is just as strong, not surprisingly in this case, as the economic impacts themselves. So with that, we'll take Q&A, and for any specific health questions, I think Carrie and Teresa will be available.
So I just want to check, see if anybody has any questions.
Actually, I have a question about the Jefferson County in Colorado. Did you look at the racial composition of Jefferson County and also the economic income level of those members and residents in Jefferson County in comparison to Delaware County?
Indeed, I did. Having, I think I didn't mention at the start. I meant to mention it because I visited as I was driving over here. I worked in Eddystone at the Baldwin Towers for about 15 years with IHS Markit, then Global Insight. So I know Delaware County, I know Chester County. I lived in Bucks County at the time, by the way, for what it's worth. But so Chester is a wealthier county than Delaware County on average. We're aware of that. We looked at average incomes. We looked at differences in the age distribution, and recognized that there were, by all means, we recognized there were differences. It's not a direct apples to apples comparison. Carrie and Teresa, you want to comment on that? Same observations go with Jefferson County, by the way. Jefferson, I guess in a sense, you might think of as more similar to Chester than Delaware, but on different metrics.
Sure, and we'd be happy to share some of the comparisons that we made on health risks and health behavior and other things. But the challenge with that is you'll never find any two counties exactly alike. And no matter which comparator you use, you're always going to have to do certain adjustments for your population's, health challenges and demographics.
So,
Yeah, I had a question, and thank you for the report and the presentation. It's great. Is there any accounting for grant revenue in this, as some departments will acquire over the course of their existence?
there is, and I'm lucky I have my team on the phone. Can you answer that, Carrie? The question was the accounting we did for grant revenues that would be available or might be available.
Well, sure. So there's state and federal pass-through money. Some of that would count under grants. Additionally, since the health department is still evolving and it will be responsive to the needs in the county, so programs, health needs addressed will change over time. The health department can always apply for grants that are specific to the most pressing issues in the county at the time. That could be through federal grant programs, state grant programs, private charity programs, state university studies, and associated programs. I don't know if Teresa has anything to add. And I apologize. She did message me before the meeting saying, like many people in the room there, she is integral to her regional COVID response, and she was able to listen only intermittently. So I apologize for that.
I assume the grant revenue would not be an offset to anything else. It would be, directed specifically to programs that would be incremental.
So the question, Carrie, is the grant revenue doesn't offset the expenses except to the extent that it's related to specific programs. Is that the question?
I think that most grant funding is associated with specific programs. But maybe expand on offset.
Thank you.
I have two.
I just had a question in regards, so am I correct in you were saying that the county's proportion is about 22% is what the county would be putting in?
It seems as though the county would have, actually 30% in the early years, but
Right.
going to 22%. That's the gap that we identified.
So one of the questions we're often asked is how much is that per person? And so looking at a county of 560,000, saying that we're around $4 to $5 a person would not be unreasonable. It's the county.
Very good question. Carrie, do we have that number quickly?
I'd say talks amongst yourselves and I will weigh back in.
Yeah, I just did a quick back of the envelope
Good.
kind of calculation of it.
I trust you can do
So
it correctly.
I bring that up only because, when you look at what you were talking about with other counties across the United States and how low public health funding is in Pennsylvania, that what we're really even asking, even in that environment, even what we're asking county residents to pay is very low considering what the rest of the country is doing.
I would agree, yes, absolutely.
Did you have another
And
question?
Rosemary, you said how much was your back of the envelope calculation?
I said like $4 to $5 a person.
Exactly, I agree, yes.
So, all right.
Appreciate your help.
All right. Anybody else have any other questions?
I was wondering about the family planning health benefit. How did you arrive at that number, and what would it take to lead to those savings for that?
Very good. Carrie, the question is how we derive the health benefits, the benefits in terms of higher health for the community.
Sure. So we looked at um, we tried to use one proxy for each of the major program bureaus that were proposed for the new health department. And in the personal health, we used the family planning, and we used for it just a proxy study. So, because it doesn't exist in Delaware County, we couldn't actually study actual outcomes there, but we used a proxy study, and we used sort of their return on investment and assumed that it would be close in Delaware County. I can send to anyone who's interested the exact study and the exact outcomes that they measured, but I think relative to other local health department, family planning, it's definitely in the normal range, the numbers that we use.
But we're talking about savings on from costs of illness, sickness, increased productivity, and the value of additional years of life, correct?
Yes, and also public spending on unwanted pregnancies and STI, avoided STI events and their sequela.
So that's a normal, the accepted way of trying to put a number on something that's inherently not numerical, right?
Well, right, and putting an ROI on public health programs is relatively new in the literature, and so there are a wide range of ways that this is approached, but the numbers do seem to converge.
Jim, one more question. I think I recall that there was an inflation factor calculated into the expense projections. Is that right?
Yes, right, Carrie? You increased expenses by 2 to 3% per year?
Well, so the numbers presented tonight and in the slides are all in 2020 dollars. However, in the accompanying Excel tool, we do offer a little toggle switch that will convert those expenses to the future projection years expenses, including the expected inflation in those years.
And is that based on expected national projections, or is that the Philly Fed for regional projections?
And they're pretty close.
Are they? Okay.
The Philadelphia inflation number doesn't differ much from the national number, and they tend to be close. And yes, we would have used national numbers. But the idea is, in terms of reporting it, as Carrie said, we reported out as though there was no inflation. There were 2020 real, what we term real terms. But we're not denying that there will be inflation, of course.
Could I ask, in terms of the county contributions decreasing from 30 to 22%, why is that decrease happening? The tax contributions.
Carrie, go ahead.
Right,
How did we gain the 8% on the savings, if you will, over time?
So kind of two things to note here. So when we first started the project, it was suggested to us that we just start the analysis assuming that 30% of budget was going to be collected in county tax revenues. So we ran those scenarios. And then we noticed that except for the first year, which is when the build out of the satellite locations would happen, and so expenses were exceptionally high in that year. We noticed in the first year we were running a budget surplus every year. So we went back and did the exercise of, okay, well, how much in county taxes would we need each year just to balance expected costs with expected revenues? And so in that first year, obviously, because of the additional cost for the additional build outs, the percentage of county taxes was higher. But then as you move through the second, third, and fourth years, it was much lower simply because the expected revenues were higher in those years. And then finally, by years 5 through 10, it did settle in at 22%. And we just looked at what is the amount of county tax revenues that are required to balance expected revenues and expenses. But the initial high point was from, exceptionally high costs in the first year, the next few years, exceptionally high expected revenues in those years, and then it settles in. Now, of course, in the Excel-based tool, if you feel that there might be a different pattern in expected revenues and expected expenses than we used, you can enter that into the Excel tool and it will recalculate those values for you.
I saw the Excel tool, but I didn't know that it was operational. So now I'll go back and play around.
Oh, yeah,
with it.
very much so. That was a great idea, I think. Howard, is that your idea? There you go. So I'm impressed.
Yeah.
And one thing to note about that, I believe that we did offer in the proposal that, we would give some training on that, do some additional work with you on that. So don't hesitate to contact us with questions.
That'd be great. And also, if you could give us the ROI information, that would be really helpful, because as we're building this out and with other counties who are also trying to build health departments, that information might be a good starting point.
Do you mean summary information from the other studies, for instance?
Yes.
Yeah.
Yep.
Carrie, did you get that?
As the background.
Yes, absolutely. Certainly.
That'd be great. Thank you.
We hadn't shared that before, had we? Technically?
I don't think so.
I don't think so. Yeah, so Carrie, we can put that together. I think that's good.
Absolutely.
Does anyone have any other questions? Everybody? Okay. All right. Well, thank you so much, Jim. I'm going to miss talking to you guys because I've been on several of the calls and over
Very
the
good.
time. Probably.
We haven't seen anybody in person, so we didn't know. Yeah.
Right.
Very
We've
good.
been on a lot of the calls. So, but thank you for all your work. This is, really
The
informative.
funny thing,
study.
I've been traveling just a bit, since restrictions eased, but this is the first time I've done it with a mask. This is tough.
Yeah, I know. We're back to that, unfortunately. But hopefully not for long. But thank you so
Well, my
much.
pleasure. Good luck going forward.
Thank you.
Thank you and good luck. Take care.
Thank you.
Thanks.
All right, so we'll continue with our agenda tonight, and so I just wanted to briefly give an update on the transition of environmental health inspections. The meetings are continuing, and to date, I've been informed that they have met with 15 municipalities, and additional 21 are being scheduled, and they hope to complete those by early September, I think at the latest. And then as we continue to work with the municipalities, there will be other meetings at their COG meetings to update them and to continue the process of what we call kind of a warm handoff, we hope. So that will continue into the fall. And we intend to have additional information communicated to the municipalities. And I believe by the September COG meeting, which is the county organization of government, that they will be able to have the initial outline of the codes and the inspection fees available, we anticipate. As we move into our staff hiring process, I was just going to ask Howard to maybe give us a quick update on the health department director and PHMC.
Well, thank you and good evening. So I'll start with last night's council meeting where council considered and approved the necessary transfers into the budget of intercommunity health, which will be kind of a doing business as the Delaware County Health Department over as we go through the transition. They approved the $3.1 million in capital expenditures that are needed to outfit both the Yaden facility and look towards satellite facilities. And then they also approved just under $5 million in other costs, which includes the agreement with PHMC. PHMC will provide assistance to the county in hiring and, if necessary, providing interim staffing. They will help with recruiting and training the incoming staff as well. They are fully resourced. Council also considered a pretty healthy contingency for that agreement, because sometimes you just never know what's going to happen. And they recognize the need to be agile and flexible as we go through the oncoming months. We will execute the agreement with PHMC over the next few days. We are scheduling a kickoff meeting with them next week to fully develop the work plan and then get their contract executed so they can begin work. So that is actually proceeding on schedule. And the one, as Rosemary said, there is one, the concern is with environmental health, which is the long pole in the tent, and we'll continue to work on that with great rigor. With regard to hiring the health director, Scott Riley from Affion will be here with some, the preliminary cut of candidates at your work session on August 19th. I spoke to him last week and expressed our need to push forward as fast as we can, but ensuring that we get the right person and not just the right person for right now. So when he comes in a week and a half, you'll have the opportunity to talk to him about where we are in the recruitment process and personally express to him the need to move with all due speed and diligence.
Great. Any questions from the executive director? All right.
If I could add just one thing with regard to the economic impact analysis. I wanted to make sure when I spoke to IHS that we did not underestimate the degree of county investment that would be needed to get started successfully. We all hope that it will be less than that, but in looking at the local costs, particularly in Chester County, they are around 23 to 25% ongoing. And we just wanted to make sure that our success was not limited by the availability of resources. So that's why it may be a little high in the first couple of years too. So there was a little bit of consciousness of thumb on the scale to make sure we would be in good shape.
Well, we do have a lot of startup costs today.
Right. Because you just never know what's going to happen when you first get started. So again, thank you for your support and for your service to the county. And if you have any questions now or separately, you know how to get a hold of me. So thank you.
Thank you so much. All right. Our next update is in regards to communications. I just wanted to update everyone on the communications committee, which is part of our steering committee from the Board of Health. And the Mendoza Group has been hired through the Foundation of Delaware County, and they will be conducting, well, they've done community meetings, and now they'll be starting their public health information campaign this fall. And it will include several items for county residents to keep them informed about what public health is doing, the benefits to the community. And it'll be a multifaceted campaign. So we're very much looking forward to that campaign this fall. And they hopefully will link in with the county's Public Relations Department, who will be designating a public health communications position for us. Okay, and an update with the meeting with the Collier counties. I've been meeting with several of the counties with their boards of health chairs, as well as the health department directors, in an effort just to get a sense of how their Board of Health operates. And we are working on a document to further go beyond our bylaws, but just to give general policies and procedures for the board, so that continues. And the regional health needs assessment. So really a wonderful opportunity for Delaware County for the first time to be included in the regional health needs assessment. And that's an assessment that's done right now in the southeast region of Pennsylvania. We are participating, representing Delaware County. Other health departments in the region participate, so we're honored that we've been included. And we'll be working with our local hospitals in this regional needs assessment. And already some really good dialogue has occurred. And we look forward to gaining, really valuable information that can help in the health department's efforts going forward. And then on our pandemic response. So Delaware County, just as a reminder, as of August 1st, is now under the Pennsylvania Department of Health for all its public health response, including COVID. With that being said, Delaware County is working closely with the Department of Health, and to respond in any way necessary, we continue to operate our vaccine clinics at Yaden, for example, and we will be addressing needs as they arise, depending on where COVID takes us, which is hopefully gets better soon. Anyway, the implications of the Delta variant are, of course, are common questions that the county has been receiving. The county's response is again with the Pennsylvania Department of Health. And as we transition from Chester County Health Department, we will be continuing to monitor the situation closely. And finally, I would like to just give a little update on the think tanks that are happening. We did have our environmental health think tank, and I don't know if Dr. Taylor, did you want to say anything about the environmental health think tank? Sorry, I didn't mean to put you.
Yes, we had our environmental health think tank a few weeks ago, and it was a very robust conversation. We had almost 70 individuals show up to the environmental health think, or show up on Zoom to our environmental health think tank. Most of the conversation, we had a few questions about inspections, but the majority of the conversation actually revolved around Covanta and air quality in the Chester area of the community.
Thank you. And Grace, who I think is still online. Grace, are you able to give us an update on the violence and injury prevention and other think tanks?
Sure. Can you hear me okay?
Yes, I think we can hear you.
Okay. All right, good. Hello, everybody. So we have had also, since the board last met, a think tank on violence and injury prevention and one on access to care, which was just yesterday. Violence and injury prevention, we had the district attorney and one of his assistants who participated, as well as a few people from a community member group from the city of Chester and a couple of other people. And we focused mostly on how we could partner with the criminal justice system, as well as we also talked about how we could use community health workers to help address violence prevention. Those were the two major things. A lot of really good points came up in the meantime, and it's clear that we have some folks who are really, really dedicated to decreasing violence in the county, and especially in the hardest hit areas like the city of Chester. In our access to care think tank yesterday, a few things came up. One was the need for mental health services, the difficulties in accessing mental health services, the need for more providers for pregnant mothers and newborns. Also, we talked a bit about how the health department could work with providers to help residents understand where they can get care and the need to get care. So some basic health information. And this was with respect not only to continue to encourage people to get the COVID vaccine, but also in terms of chronic disease and the need for folks to access care wherever, to get in and make sure that they're getting proper screenings and that kind of thing. And then finally, we also heard again, loud and clear, about the need for case management. The fact that there are providers and there are services in the county that exist, but some people have difficulty accessing those services because they really need assistance getting those connections. We have 3 additional think tanks that will be scheduled in the fall, no sooner than September. Those will be on health equity. We'll have a second think tank on that. We will also get groups together to talk about emergency preparedness and response, as well as behavioral and mental health. So stay tuned. We'll get those scheduled sometime in August, and they will be held. 2 of them will get scheduled in August for sometime September or later, and then behavioral and mental health, we will get that one scheduled. We'll get that one on the books sometime in September, again, for later in the fall.
Great, thanks so much, Grace. And again, they're really, the think tanks have just given us a wealth of information, and I really thank you for all the work that you and your team are doing on that.
Rosemary, could I ask a question?
Oh, sure.
I just want to go back to pandemic response for a second. With the severance of the relationship with Chester County and the Department of Health, Pennsylvania Department of Health, having responsibility for the county in the interim, we've lost data that was very valuable. We no longer have the granularity of incidents and positivity in those at the township level, for example, or the school district level. And I know that the school superintendents are very much interested in having that. My question is, are there ways in which we might be able to recreate that? For example, I know there's a desire to know the vaccination rates at the school district level, and I've looked into it a little bit, and I know that the state has numerator data, but I'm wondering, is there a way for us to supply denominator data and enable the districts to have that sort of information? We don't have to go into this in great depth tonight, but I just wonder if we could consider that offline.
Yeah, the problem is, right now, we don't even have an epidemiologist on board, and technically the Pennsylvania Department of Health is the one that has the data. But we can talk certainly offline. I think we've been told that it's a problem, and we knew that was going to be an issue when Chester County left.
Yeah.
But it also makes the argument why we really need the health department. And
Yeah,
so
the school districts already have 3 different sets of guidance on return to school issues. The Academy of Pediatrics, the CDC, the Department of Education / Department of Health will probably come out with another set of guidance, and then the CHOP Policy Lab has a 4th set of guidance that a lot of people put credence in. None of them are aligned. So the superintendents feel sort of adrift and are responsible for making those decisions.
yeah, and it's understandable. Unfortunately, the county has little ability right now to do that until we're a health department.
I have a question. Is it possible to push the Pennsylvania Department of Health with some of these data? And I'm sure they have an epidemiologist that can assist.
So the Pennsylvania Department of Health has already told us that they would not be giving us the level of data that Chester County had been providing us.
That's why I asked if we could
Yeah.
recreate it.
So we've asked them, but they have not been able to. And I don't know if Monica wants to say anything to that.
Pretty much to our understanding is that because we are not a health department, we are not able to receive that level of data. And the reason why we were receiving it before is because of our relationship with Chester County. So they had the data and they were allowing us to see it because of that, because it was going through the Chester County Health Department. And just because of the way the laws, I believe the act is set up with the state health department, we are not allowed to see it until we are an official health department, unfortunately.
Right, and Chester County would receive that data, but it was raw data, and then they were able to utilized, they had a program that utilized an ability to break the data down, but it was not an easy thing. And it took them quite some time to be able to get that data into a place that could actually go down to as far as a school district or a zip code. So
Right.
it was-
And then the first step was getting the raw data at all. And so that's what
Yeah,
we actually don't have access to.
Right.
Even if we hire the epidemiologists and get them trained, it's January is the.
Yeah.
Yes.
Well, yeah,
Yes.
yeah. They might let us slide at the end, but it depends on the epidemiologist. I didn't just say that publicly, but anyway, we are working with the Pennsylvania Department of Health and trying to work towards helping the school districts and everyone make the decisions that they can. But it is going to be different than having Chester County. I mean, that was part of the reason that we were lucky that Chester County was able to provide all those services for us in the beginning. So we will just have to make the best we can with what we got. Any other questions? Okay. Just wanted to check if there's any new business for the board in addition to what we've covered. And I believe we have somebody who wants to make public comment. So if you could just give, yeah, you can come up to the podium. And if you could just give your full name and residence.
Hi, thank you. Thanks for your service. My name is Bob Clements. I live in Media, Pennsylvania, 600 West St. Andrews Drive. This is in regards to what was just recently talked about with the school opening, concerns. It's more of a proactive request than anything. So there's a lot of conflicting information out there, specifically for kids and specifically for masking. So with the Pennsylvania Department of Health, with the limited data that we have access to or no longer have access to, as you just mentioned, I just wanted to be cognizant of this, and I'm kind of here on behalf of a number of parents who I've talked to since last school year, all throughout the summer, who have concerns and their kids are terrified of being put in masks again, understandably so. So I just want to make sure that if we go down that path again this year, and this is possibly a request that needs to go to the Pennsylvania Department of Health, and I'd be happy to talk to them. I just want to make sure that we're really looking at the data, transmission risk for students, them being a vector for transmission risks for adults, especially with the vaccination available now, and then counterweigh that with the risks of masking children for extended periods of time. So I feel like that second part was very much missing. There's a lot of studies that came out originally even from the AAP that talked about developmental issues, that talked about bacterial issues, recommendations not to mask, and recommendations to return to full in-person learning. Then they reversed course on that. But I don't remember ever seeing any studies being done on the possible downsides when it comes to masking, especially for children. Adults, we can deal with that like adults, but kids, bacterial infection, no standardization of masks, developmental concerns, respiration concerns, headache, fatigue. You know, there's a lot of studies out there that say those are risks, then there's studies that say they aren't. There's not that I can find any peer-reviewed studies that say that this is a significant risk for children, nor are they a significant risk to transmit it. So figured get to start somewhere. So I'd bring up the concerns now and bring them up proactively. So again, thank you.
Thank you so much.
Thank you.
Yep. And just to let you know, so we can, make the Pennsylvania Department of Health aware of it, but as a Board of Health, we have no jurisdiction over the school districts in the county. Okay. Right now.
So that jurisdiction comes from the Pennsylvania Department of Health?
We are under the Pennsylvania Department of Health until we are officially a health department.
So they would make recommendations for all of the Delaware County school districts?
Yes.
For all the school districts, really.
For all the school districts
whole
in
state.
Pennsylvania. And then if the individual counties that have, a health department can make stricter guidance depending on what, so for example, Philadelphia may choose to do a stricter guidance. But the original guidance, and then the Pennsylvania Department of Education, along with the Pennsylvania Department of Health, has a working group that is supposed to be working on that guidance for for the school district.
Afterwards, we ask them to provide, to back up any guidance they give with that kind of pro and con weight.
Yep, I think we can ask them to, yeah, and that has been a request, to be very clear on the masking guidance. It's the number one question. But as a county, we have no jurisdiction over the school districts or private schools.
I think it's fair to say that the studies are hard to come by, and the guidance is, usually put out with references. The CDC usually is, heavily referenced. Child Policy Lab is heavily referenced. The American Academy of Pediatrics is as well, and the PDA, PADOH is perhaps to a lesser extent. But the conclusions have all been different, and so it leaves parents and superintendents in a quandary as to the choices they make, which is why I was looking for better data, because when you look at the county, there are clear differences by district, and by as small a county as this is geographically, there are very evident differences in rates of transmission in different townships and municipalities.
Hello. My name is Kieran Warren. I live at 2525 Sandyland Street in Chester. I just have a couple of questions. One kind of piggybacks with this gentleman had started with asking about the school districts and masking and COVID. I would like to know if there has been any tracking so far of the Delta variant as it pertains to children and youth. In Chester, as you probably already know, our vaccination rates are very, very low. So I was just wondering, how does that relate to going back to school and with the children, and if we have any numbers on the Delta variant?
So again, as a county, we're not operating as a health department, and our data would come from the Pennsylvania Department of Health. We've been told that the Delta variant, as all of the Southeast region is, we're in significant spread right now with the Delta variant. So we would assume that it would be across all of Delaware County, including Chester.
Okay, thank you. Another question I have has to deal with the environmental health issues that the city of Chester is facing. I would like to know, how will the new health department collect and make available environmental health data by municipality so that we can better understand the actual rates of asthma, cancer, and other health problems as it relates to places where we live, like Chester, where Covanta is actually located?
So the intent, once the health department is operational, is that we will have an epidemiologist and a team of people that will be monitoring all of the the diseases that you had just mentioned, in addition to all of the other health factors that can be part of that. And we would hope at some point, once we are operational, that we can start to target, interventions. However, that's going to take time. And so I know that the council is also looking at a possible commission or other interventions regarding the Covanta issue. So I think it's going to be like a broader range response, and it's going to take over time, but we would be certainly tracking, asthma rates and cancer rates and other things that would be issue around that area, knowing that sometimes it's hard to actually pinpoint specific reasons. So that would all be part of our larger endeavor in looking at that, particularly in the city of Chester.
Okay, thank you. So there is a plan to, once it's set up, the health department's officially set up, and you have the proper medical professionals in place, that that will be a priority of the health
Well, I can't say
department?
that it would be a priority because we're still setting up and there's lots of issues in the county right now. So but it would be something that we would normally monitor and target and identify issues in communities. And once we will be looking at the data across the board and, working with the community to identify these issues. I just can't say, we don't even have a health department director yet, so I can't even tell you what is a priority or what's, but we certainly recognize that that is an issue. And again, I know council is very much aware of it and plans to work closely with you in
Okay.
trying to address that.
And I came in a little late, so I think you've already touched on some of the other questions that I had that were surrounding the medical issues with health equity as far as maternal rates of death are concerned. Is that something, well, I know that you can't answer a lot of these questions, but I'll just put them out there anyway. Is that something that you will be, or the health department will be focusing on? Is that included in that health equity portion?
Absolutely. So particularly, for example, one of the things that we had mentioned earlier is the regional needs assessment, for example. And that's done regionally with the hospitals and county health departments, and that often identifies areas of concern. So that's just one of many tools that we will be looking at. But in regards to maternal mortality and morbidity, particularly in certain communities that maybe have higher incidence rates, then I think we would look for targeted interventions at that time. But that's the great thing about having a health department. So we would hope to be working very closely and utilizing community resources and things to identify evidence-based interventions that may be helping particularly target maternal morbidity mortality.
Okay, thank you. And I won't ask any more questions because you pretty much have answered them, and I know that you you've tried to answer a lot to the best of your ability. I'll just put this out here, some of the concerns that we have that you've already kind of touched on, but just to hear it from me, the access to care that you've already spoken about, the health statistics and data from COVID and the Covanta incinerator, and just other elements. The distribution of health information to residents, to have that easily accessible. And that's it. So thank you.
Thank you, and that was really, really helpful to hear that. And so please keep us informed, and we really want to hear about what's important in your
Thank you.
neighborhood. So, thanks.
So are Chester, PA residents able to get this data about the Delta variant from the Chester County Health Department, or no? Nobody is able to get this?
The Delta variant we're getting from the Pennsylvania Department of Health, so the updates, but it's, what they have given health alerts and different updates throughout this, and that's on their COVID webpage, but you can also, we can try to make a request to the Pennsylvania Department of Health for additional information.
It's important to note that the only way to know whether you have a Delta variant or not is by sequencing the positive test. And throughout the country, not just in Pennsylvania or Delaware County, sequencing capabilities are very limited. So all of the sequencing that's being done right now is showing that essentially 100% of the viral isolates in this region are Delta. But when Lambda starts, or the next one, that's a hit or miss proposition because we're only doing a very small fraction of all the positive tests. And that's done by academic laboratories for the most part, not by, to some degree, by public health laboratories.
The other important thing is, though, and I'll just say publicly, is that it doesn't really change so much of the things that we're telling people to do, and that's starting to really wear your masks, especially if you're in public places. It's really looking to make sure that you're washing your hands, all the things that we've been saying over and over again, trying to do social distancing if you're in a crowded area, staying away from indoor populated events and activities. So unfortunately, we're back to that song again. And PJ, if you had anything else to add in that, but I think, I know it's scary for people to think about another variant or going down this road, but, you know, we do have tools in the toolbox, and getting people vaccinated is the number one thing that we can all try to do right now. All right. Well,
Rosemary, I'm just curious, how are people still going to get vaccinated? Are you getting business?
the vaccination, has slowed down significantly, and so that's why the county has begun to draw back. We had our mobile clinics and other things, and I don't know if Howard had any updates, but we are trying to build the capacity for the health department at the same time as we're trying to respond to COVID. But there is a lot of private providers right now, so the county may not be the need to be the primary provider like we were in the beginning.
And that's correct. The number of vaccines that the county is providing has gone down significantly, but we are still providing all 3 vaccine options at the Wellness Center in Yaden 3 days a week.
And I think you're prepared if there need be to do boosters and other things if called upon, is what the plan is, right?
We're preparing to do that come this fall. We also still have some opportunities for community and pop-up type events. We were out at the National Night Out this past week at Marple and Springfield Township, and on a limited basis, we're still doing homebound and vaccinations as well. So we'll serve the community however they need to be served, but the demand has decreased.
All right. Is there anything else for the Board of Health tonight? All right. Thank you all for joining us, and we are adjourned.
Thank you.
Thank you.